First on the American health front, thousands of people face major surgery every day. What used to be a frightening thought is now less traumatic and less invasive, thanks to medical technology and techniques that has transformed many procedures.
Today, most surgeries can be performed with minimally invasive techniques using laparoscopic surgery. We went to surgical practices of South Texas, a multi-specialty surgical group of board-certified surgeons, to learn about the cutting-edge minimally invasive technology they offer. Dr. Joseph Coopwood, a general surgeon with the group, explains.
Minimally invasive surgery, which is also called laparoscopic surgery, is a technique by which small incisions are made in the abdominal wall. Special tubes called trocars are placed through these openings to allow access for instruments. And we also use a camera, also called a laparoscope, in order to visualize the abdominal organs. We can use pencil-thin instruments in order to perform the surgery on the inside. The advantages of minimally invasive surgery, as opposed to the traditional techniques, are the use of the smaller incisions, which avoid more painful, larger incisions. This allows a patient decreased time in the hospital. Many procedures can be done on an outpatient basis. The patient can return to work sooner and return to their lifestyle activities much sooner using minimally invasive surgery.
Dr. Samuel Pangburn and Dr. Daniel Vargas are preparing for a laparoscopic gallbladder surgery.
One of the most common surgeries we perform nowadays laparoscopically is laparoscopic cholecystectomy. It used to be performed open through a large incision under the ribs on the right. Nowadays, it can be performed through several small incisions. And what we found in many studies is that there's less postoperative pain, shorter hospital stay, quicker return to work with these minimally invasive laparoscopic techniques. And now it can actually be performed on an outpatient basis as opposed before the open surgery entailed a 3 to 5 day hospital stay just to recover.
Even though laparoscopic cholecystectomy is the most common laparoscopic surgery that we do, there's many others that types of surgery that you can get the same benefits from. Laparoscopic appendectomy, for instance, is one problem that we see very often from the emergency room, and those patients are able to get all the same benefits that from the laparoscopic surgery that our cholecystectomy patients do as well.
Millions of people have colon and rectal problems, from hemorrhoids to colorectal cancer. We'll learn about diagnosis and treatment for these problems. Dr. Rolando Saenz and Dr. Sarah Marcinissen, both general and colorectal surgeons, discuss these.
Within the realms of colorectal surgery and colorectal problems, we find that for the most part, this is a part of medicine that not too many patients freely come to us and are very forthright with regards to their problems. There's a lot of associated embarrassment with it. One of the things that we do in our practice that's nice is we have a full gamut of colorectal care because we do have 2 board-certified colorectal surgeons who so happen to do general surgery as well. One of the things that we do that's very practical for most folks in everyday life is we offer an anorectal physiology lab where we can actually run all the appropriate diagnostic tests to essentially come up with those answers.
Most colorectal cancers and deaths from this disease are preventable through a simple colonoscopy screening.
So we recommend doing colonoscopies starting at the age of 50 for a number of reasons. One, most colon and rectal cancers present at the age of 50 or over. Most colon and rectal cancers come from polyps, which we can take out with a colonoscope before they turn into cancers. And also most early stage colon and rectal cancers cause no symptoms. So we recommend starting screening at 50, sooner if you have any problems, otherwise at 50. Most of the time we can take out small polyps with a colonoscope. However, if we find a big polyp or an actual cancer, we will recommend surgical resection. That surgery can often be done laparoscopically, where we make small incisions, take out the area where the cancer is.
If further surgery would be needed, minimally invasive techniques such as a laparoscopic or hand-assisted colectomy would be considered. Dr. Dilma Ruiz-Friel and Dr. Moises Solis have, as part of their practice, implemented breast conservation therapy.
When we were discussing the films, you can see the tumor, even tumors up to 2.5 cm, they can be even treated with breast conservation therapy, which is actually minimally invasive surgery in order to improve cosmesis. We go ahead, we remove the tumor with a margin of normal tissue. During the same surgery, you can actually establish to see if the lymph nodes are involved by doing sentinel lymph node dissection.
Surgical Practices of South Texas takes patient care to the next level with a full spectrum of complete care in the diagnosis and the treatment of many surgical health concerns.